Welcome to The Explainer. Have you ever wondered what exactly your doctor is looking for when they ask for a urine sample? Well, today we're going to solve that kidney mystery. We're going to pull back the curtain on the step-by-step detective work that doctors use to check the health of your body's most vital filtering system. You know, the whole investigation really begins with clues you probably notice every single day. Things like the color of your urine, whether it's cloudy, or even just how many times you have to run to the bathroom. Believe it or not, these are the very first breadcrumbs on the trail to figuring out what's going on with your kidneys. So, before we even get to any of the fancy tests, a doctor's investigation starts with you, with your story and a physical exam. They're basically on the lookout for those initial telltale signs, and a lot of times they pop up as simple changes in your daily routine. Let's start with something really common: frequency. I mean, sure, we all have days where we've had a ton of water, but what if you're consistently making 8 or more trips to the bathroom during the day? Well, there's a medical term for that. It's called pollakiuria. And it's not just an annoyance, it's a really clear signal that something needs a closer look. Another huge clue is pain. Any kind of pain or discomfort when you go to the bathroom, this is called dysuria. And while there can be a few reasons for it, it's pretty much the classic sign of a urinary tract infection. And you definitely don't want to ignore it. Now, on the complete other end of the spectrum, what if you're barely producing any urine at all? We're talking less than 50 milliliters a day. That's a condition called anuria. And let me tell you, this is a serious red flag. It could point to a major problem like a blockage in your urinary tract or even something systemic like shock. And the clues aren't just limited to what happens in the bathroom. Your kidneys are connected to, well, your entire body. So doctors are also piecing together this whole constellation of other symptoms. That nagging pain in your side, new or hard to control high blood pressure, swelling in your feet and ankles, even weird rashes on your skin. Yep. All of those can be signals coming directly from your kidneys. Okay, so once all those initial clues are gathered, it's time for the first big test, the urinalysis. It sounds pretty basic, right? But don't let that fool you. This 3-part investigation can unlock an absolute treasure trove of information from just one tiny sample. The whole process breaks down into 3 really distinct stages. First, there's the eye test. What can we see just by looking at it? Is it cloudy? Is it clear? What's the color? Second, what does a little chemical strip tell us about what's inside? And finally, the really cool part, what's hiding in there when we put it under a microscope? So this dipstick test, it's incredibly powerful. In just a couple of minutes, it gives this amazing chemical snapshot. It's checking for things like acidity, protein, sugar, any signs of blood, but it also looks for something called leukocyte esterase and nitrites. And those two, they are huge telltale markers that point right to a urinary tract infection. All right, now for the microscope view. This is where doctors go hunting for something really fascinating called urinary casts. Just imagine them as these tiny, perfect little molds of the kidney's own plumbing. As they form, they trap cells and other bits of debris. And what you end up with is a literal snapshot of what's happening deep inside the kidney. It's amazing. And get this. Not all casts mean the same thing. For example, a hyaline cast, which is basically clear, can be totally normal. You might find one after a really tough workout, or if you're a bit dehydrated. No big deal. But finding a red blood cell cast, well, that's a completely different story. It's a clear-cut sign of bleeding inside the kidney's tiny filters, and it's a hallmark of a serious condition called glomerulonephritis. So what happens if that urine test raises some questions? Well, the investigation is far from over. The next logical step is to move from the urine to the blood, to measure how well the kidneys are actually doing their main job, which is filtering all the waste out of your system. This number right here represents the glomerular filtration rate, or GFR for short. The easiest way to think about it is as your kidney's performance score. In a healthy young adult, you really want to see a score of 90 or higher, though it is pretty normal for this number to slowly go down as we get older. Okay, now this is an absolutely critical point, and it can be super misleading. You might think, hey, my creatinine level on my blood test was normal, so my kidneys must be fine. But that is not always true. There's this thing doctors call the creatinine blind range. And this is wild. You can lose up to half of your kidney function before this very common blood test even starts to show a problem. So how in the world do doctors see inside that creatinine blind range? Well, this is where they really become detectives. They use some pretty clever calculations And by comparing different waste products, they can start to figure out not just if there's a problem, but where in the system it's actually happening. And they do this by looking at the ratio between two waste products in the blood, creatinine and something called blood urea nitrogen, or BUN. The ratio between these two gives a massive clue. See, a high ratio, we're talking over 20-1, often points to a problem that's happening before the kidney, like maybe you're just really dehydrated. But a lower ratio, that suggests the issue is intrarenal, meaning there might be damage inside the kidney itself. So what happens in the most complex, the most puzzling cases? When all the other tests just don't give a clear enough answer? Well, there's one final step doctors can take to get a truly definitive diagnosis. And that final step is a renal biopsy. This is where a tiny little piece of kidney tissue is looked at under a microscope. Now, this isn't a routine test by any means. It's really reserved for very specific situations, like trying to identify the exact cause of severe kidney inflammation, investigating sudden kidney failure, or checking on the health of a kidney transplant. So there you have it. We've followed the clues all the way from a simple urine sample to a microscopic piece of the organ itself. It's this incredible journey that shows the amazing detective work that goes into protecting our kidney health. And it really leaves us with one important question. Now that you know how it all works, what's the best way to keep your kidneys healthy in the first place?